Good morning, dear students. This is Dr. Rathod, the professor, working in the Department of Forensic Medicine and Toxicology. Sri Lakshmana Institute of Medical Sciences. Is my slide is visible to you? Just check. Yes. Then let me allow to take your class. Today's class is on the chapter that is the Thanatology. Tos means death, logos means science. It means the science of death. Okay. Then word you are in the Department of Forensic Medicine, the new term you will find the forensic thanatology. The word has been found. The word forensic. What is that? Forensic thanatology. That is nothing but the science which deals all aspects of it, including medical legal aspects. All aspects. Which are the small component you find in the aspects you are going to learn in forensic thanatology. What are the types of it? Manner of it, modes of it, mechanism of it, cause of death, sudden death, delayed death, agonal period of death, mechanism of death, presumption of death, survivor of death, then signs of death, cause of death, time of death, presumption of survival, presumption of the component we will see in the topic. But before that, in this chapter, what are the objectives you are going to learn in this session? In this topic, after going through this topic of forensic thanatology, the learner phase 2 MBBS students is able to describe that what are the types of somatic death and molecular brainstorm death with medical legal aspects, especially in relation to the organ transplantations, suspended animation, modes, manner, mechanism, cause of death, estimation of time since death, whether the immediate death, early death, or late, changes after death, and factor modifying such changes, and medical legal aspects of immediate, early, and late signs of death. What is the difference between postmortem lividity and bruising? What is the difference between cadaveric spasm and rigor mortis? What are the conditions simulating rigor mortis? Postmortem changes by the predators. Forensic entomology, that's entomology science of the cadaver, and postmortem interval, time of death. These are the objectives of this topic. We'll take small parts in each class. Again, we'll discover specific learning objective of that topic. So you will see the thanatology. Thanatos is a death, and logos is science. Then new word to find a death. Then what is the death? Legal definition, law has not defined the death. But the Black Dictionary, Medical Dictionary of 41st edition has described. I got this one. I presented to the core book page. That has been mentioned. That is a cessation of life, right? Ceasing to But according to legally, a person is dead after somatic death. It is a death as a common man understand. And what is a death? It is a complete, irreversible cease and stoppage of functions of central nervous system, cardiovascular system, and respiratory system. We call it the three systems tripod of life. That is a complete, irreversible cease and stop of the functions of these three systems. Okay. Next, the death in general is the end of cessation of life. It is a permanent cessation of all vital bodily functions. When we consider that the person is dead, circulatory system, or circulatory and respiratory functions and functions entire body. For the fear of burying the patient while he is alive, that in a coma, or something like that. When to issue the death certificate? Complete, certified. First is the duty of doctor to examine, pick, and resuscitate the patient. Try best. If reversible, life. After several attempts, you find it cannot be a reverse, irreversible season start. Are made attempts, and you find somatic death has occurred. Even available life supports. Okay. So question comes when to certify death. That must be diagnosed before stopping the first aid or surgery. The doctor may decide to stop the machine that life support, maintain respiratory itself will determine the life of the patient with the brain stem, and the exact moment of death can be determined. So in today's forensic thanatology, death, we are going to learn signs of death. We'll see in the next classes. Other component. The signs of death is subdivided in three groups. That is immediate signs that constitute the somatic death. In somatic death, what happens? Vital function, cease and stop. But molecular function is that all tissues are alive. They use oxygen. Okay. Somatic cease and stop of this three system function. We can say insensibility. Early signs denote the molecular death. Each tissue, a cell, organ, cease and stop. So here question comes, why do we need to study the molecular death, early signs? Because it is important to where it is organ transplantation. Before life, the person has agreed voluntarily given a consent for organ donation, can be retrieved, can be taken. So this is very important. And it varies for organ. Some organs or tissues, molecular death, cell level death, are just early. Some may take time, 2 hours, 3 hours. That is a bone and blood. But earliest, you can retrieve like require kidneys, cornea, heart transplantations, liver transplantation. Has to be taken. That's needed to denote before occurrence of molecular death. And stuff. That is a system, that is a somatic death, and we see the immediate signs. Signs, what is the sign? Sign is observer's finding, and you learn symptoms. That is patients. Alive patient is a person who is the feeling. It is fed symptoms. Here we are only in cadaver. Here we are studying signs of death, how to find the signs. Okay. And most of the instances happen in a cold. What is the early symptoms, late symptoms? Don't be not medical. You understand and proceed with the science. Okay, it happens. Then another is the late science you follow after about 24 hours after death. Represent decomposition, decay of the body, or sometimes it depending on circumstances, environment changes. There are modification may occur, maybe the supinification or mummification. We'll see in the detail later. Here has been divided into three types. Again, you find it. What is the immediate side? Includes insensibility and loss of EEG, encephalography, rhythms, sedation of circulation, sedation of respiration. Insensibility means loss of sensation, perception of touch, pain, temperature, even loss of voluntary power to the move. These signs are not conclusive of death, as in some conditions you may find a loss of perception of touch, pain, temperature, power. Examples have been given here are the like fainting attacks, vagal inhibition, status epilepsy, or drowning is there, electrocution is there, a transient period, you may not find. Where some victim may recover entirely. In electrocution, if you resuscitate up to 1.5 hours, the patient can be needs. Do not be hurried for declaration of death. So learn this. So here has been mentioned these signs are not inclusive of death. Insensibility before going to find the circumstances and decide. Resuscitate. They can be taken conclusive only when associated with loss of EEG rhythm for a continuous period of 5 minutes. Has to be recorded, documented, can be taken as conclusive. Okay, if you have it, you can find this one. Absence of reflexes as a jaw, no jaw reflex or gag. You examine whether the gag reflexes there are jaw. Or you can demonstrate and find is there a response for the pain or no, no response to the pain, no babyliss is kind. Flat EEG. These are the signs. Signs of immediate signs. Another second one is sedation of circulation. Central nervous system. Cardiac functions. Season stop, circulation. Careful auscultation is very important here. Heart sound are not heard a continuous period of 5 minutes. It is acceptable as evidence, but before hearing the heart sound, just check. You're using instrument like stethoscope. Then just it is properly functioning or you have placed correctly location. That is, you cannot just. You just see the equipment works. Even you are hearing with ear on the chest. You may not hear if the person is obese. The conditions are there, but careful has been auscultation. So heard sounds are not heard for a continuous period. It is acceptable evidence of a death. Central pulse on palpation. Radial pulse you can find pulse palpations. You just see heart auscultation, heart sounds auscultation over the period of 5 minutes. The criteria has mentioned assisted continuous electrocardiography, ECG display is assisted on continuous ECG or flat ECG. This criteria can be supplemented with the hospital by if the patient in the hospital. Absence of pulsatile flow using the direct intra-articular pressure monitoring system. you have. You find absence of the pulse type flow, absence of contactile activity using echocardiography, or contact of the skin with a hot object doesn't lead to congestion, that is reddening, sense of inflammation, so reddening, a flushing, application, hot object. But there is a differential diagnosis for two. On cutting small artery, there is no spotting of the blood. These are the simulator. It is not two pictures, just and example for teaching purposes has been presented here using the blood like coloring agents, cut it like usually the cutting of artery. Even a wave between the finger become opaque. Transillumination. You take a torch battery in a dark room and find there is a transillumination in the dark. There is a finger web is become opaque. It is a normal. It is a translucent. You find red due to the circulating blood cell. Not circulation. You find opaque, opacity, cloudy. If injected fluorescent, a dye, coloring agent, doesn't lead to yellow discoloration. On the distance means circulation is on. The dye has injected that is moving and staining the other areas. This subject is. So there are some tests to detect the stoppage of circulation. These have been listed in the on the table on the slide in the form of tables. Tabulated these figures. A serial number has been used for test. Sometimes maybe asked as MCQ to you as I have questions. There's some test and how to interpret continuous circulation present or no, stoppage of circulation that has been used. Arterial pulsation test that is a present in a continuous circulation. Person is alive to the pulse attack pulse. Absent in a stoppage of circulation, pulsation will not find it. Electrocardiography test, you will find the curve. PQR, you know the ECG lights curve. And stoppage of circulation, you find heart stop. That means that is a flat. But you just take that the ECG machine is working in condition or not. Lead is correctly placed, battery is there. Okay, the conditions are there. It is fully functional and you find flat. There, as start circulation has been started. ICAR test. Subcutaneous injection of fluorescein in sodium bicarbonate. Once you see 25% solution. Yellow discoloration of skin present, then circulation is function. Stop with no discoloration. The flowing area, skin means absent. Magnus test. What is the Magnus test? Maybe ask the MCQ service, post the examination. If a ligature is applied around the finger in a such a fashion that venous return is stopped without the hampering the arterial circulation. Within the short time portion, if a finger distal to ligature will show bluish discoloration and edematous. The sinus is there. The area has been applied pressure, block, venous, return. Discoloration is there. Circulation is there. So you will find circulation, the bluish discoloration. Patient is alive. The area is light. Interpretation is different. Finger, the circulation is going on. It is the no change. There is no circulation in that part. Or maybe human being. Okay, the heart is beating up. Or that only limb as is obstruction, constriction, depending upon how to interpret. But if it has this considered patient, there is no obstruction to anyone, a patient is alive or not, depending upon the bluish discoloration or no change. That is Magnus test. I remember the finger. Diaphanous test. If the hand with outstretched finger is held before the bright light during the continuance of the circulation, wave of the finger will appear. The person is alive. of blood circulation in the hand, where the translucent reddish in appearance. If there is no circulation, then you have opaque and the pale yellow, not reddish. Okay. Fingernail pressure. Just apply the pressure on the finger, nail. A person is alive or not. What you say, clenching. If a foam pressure is applied over the fingernails, it appears pale on the pale, and on release pressure, normal reddish. If you do this and then nothing, you see such changes. A pale light color, then release again reddish normal color. So that circulation has been stopped. These are the things. So you can remember Magnus test, Raffles test, or you can describe with the using the area what has been done. Or sometimes maybe ask the who has devised this test. The scientist name has been given in textbook. Signs of somatic death continuation when it's come. We have seen the immediate signs of death. No, that is insensibility, cessation of circulatory system, cessation of respiratory system. Is the third one. Complete. What is the third one? Is the cessation of respiration. Two you have seen insensibility, cessation of circulation, or cessation of circulation. How to test it? Seize of the start. Complete absence of breath sound is a continuous period of 5 minutes. Constitute proof of death. An instrument is a current. Or inspection tip. Inspiration, chest expand, expiration. Just to find the movement of the chest. And that absence of thoracic and abdominal respiration. There's no movement. Under what we can apply? Absence of breath sound on prolonged auscultation over the trachea and over the chest, where lung areas are there, lungs over the chest. And trachea, you find absence in C's. Okay, the picture denotes to you. Another is that if humidity is there in the environment, or in the respiration, inspiration and respiration, the respiratory system is functioning. If you hold the mirror in front of the nostrils, you will find the patient condensation of water, vapors. But no condensation of water vapor by putting the mirror in front of the nose. What does it do? What feather is there? Hold in front of the nostril. It is moved. There is no movement of the feather. Put in front of the nose and lips. But observers face to most of the time patient is sees the function is sees and stuff, and the observers, it may be a respiratory movement may move. So interpretation has to be demonstrated. Just see a fan is not on. You saw and your movement, respiration movement is not moving the no movement of fever in front of the disease suspect. Nose in front of the nose, partially open the mouth, that's lips. Okay. Next, a loss of facial wrinkle leading to complete muscle flacidity and loss of power of excitability to electric stimuli. I have find my observation I wanted to share here. Most of the relatives, they know their families and their age, geriatric. Unfortunate and past. Sometimes it happens. Most of the circumstances, went to the city or somewhere in a train, bus, season. Body comes to the module, then we find who is who, and then find the relative. When they come to visit the module, they find and sometimes it's not there. They even finding difficult. Why? After they this muscle get flaccid. So even this wrinkles. You will not find it. It's like young. So even people may find it, no, this is not the result. So this happens. This is one of the signs. That is muscle, primary flaccidity happens, loss of facial wrinkles leading to complete muscle flaccidity and loss of power of excitability with electric stimuli that have been shown. Then skin changes, you find loss of skin and muscle elasticity and contact flattening. That area you find here that have been shown. Facial fight, the blood, what has been in a gravitational force, now circulation has been starting. Blood pulled down as a gravitational force collected. But pressure side, you will not find the discoloration. You find the contact flattening. You find pain area, white area, that is the pressure side. That is called contact flattening. This area, loss of skin and muscle elasticity, blood vessels get compressed and blood will not be collected. Blood vessel. Okay. So how to test the respiratory system has been mentioned here. Test to detect the respiration. There are some tests. Flash on the slide. One is respiratory movement, continuance of the respiration. Respiratory movement you can make it an example. Just is moving abdominal respiration. Breath up respiration. Stop. There's no movement. Breather test. That simple name you can identify. If breather test is or even not available, fine cotton fiber can be used held in front of the before the nostril. Moments of the data article, fiber of fever, feeble respiration. Okay. No movement of the sneeze. Winslow test, a ray of light is allowed to fall on the small pot, which is filled with the water, and reflection you find on the other side. Light allowed, you find the reflection. If chest is moving, that a ray of light appears moving. Filled pot with the water and light allowed and that the reflection shows no movement, that is that is Winslow's test. Maybe ask him if you just be aware of this, but it's Winslow's test. A mirror test, if a mirror is placed in front of the partly open mouth or nostril of a living person, you just see a reflecting surface becomes hazy due to deposition of the moisture. That's the respiration zone. Cessation of respiration will not make such changes. No such changes are expected. We have seen early signs, immediate signs. Now we are going to see that is early signs of a death. What is the death? These early signs follows within about 12 to 24 hours after death, and that is person sees and starts within the 12-hour changes we find, that has been mentioned immediately. Here it has been follows within about the 12 hours, 12 to 24 hours after death, includes cooling of the body, changes in bodies, changes in the skin, post-mortem debility, and changes in the muscle. We'll see this slide in later classes. Okay. What you learned today? What did you learn today? What is the thanatology? What is the forensic thanatology? What is the death? And what are the signs? We are taking signs of death. In signs of death, what are the three types of signs of death has been mentioned here? Immediate sign. What are the signs of death we studied today? Immediate signs of death, early signs of death, and late signs of death. Just outlining the topic. Today you are seeing immediate signs of death. One is insensibility, cessation of circulation, cessation of respiration. The rest of the part, early signs of death, we'll see in the next class. If you didn't understand this, just put your question. You have a doubt, a question, put in the chat box. If no doubt, I didn't see any question from your side. If no doubt, then we'll conclude here. The message for you, just because of this COVID-19 era, is the infection spreading fastly. So keep social distancing. Use mask. Take care of yourself and your parents. Well, learn a bit better. Hand hygiene. Thank you. Bye. Have a nice day.